Hello and welcome to Pixarize's scene on familial hypercholesterolemia, also known as type 2 dyslipidemia. In this scene, we'll quickly review everything you need to know about this lipid disorder, including its pathological cause, its inheritance patterns, as well as its clinical findings on exam. Let's get started. Since this scene is about hypercholesterolemia, the anchor for this scene is a coal spill. Namely, this coal truck has crashed into this wooden dock, spilling the coal it was carrying into the water. The increase in coal should help you remember the corresponding increase in cholesterol in these patients. Now let's focus on the cause of the accident, our coal truck here. This large, dominant truck should make you think of a dominant automobile, which happens to be our recurring symbol for autosomal dominant inheritance. Big cars like these tend to be involved in accidents in our scenes, which should also help you differentiate them from the other diseases with autosomal recessive inheritance. Examiners typically ask questions about the likelihood of disease in a child, given a parent with a disease. Just remember our dominant coal truck, and you'll be sure to remember that hypercholesterolemia is inherited in an autosomal dominant manner. Next, take a look at this broken dock here. This dock seems oddly familiar. Wait, wasn't this the LDL receptor dock from our scene on the apolipoproteins? That's right, this broken dock here represents the defect or absence of LDL receptors that causes familial hypercholesterolemia. Again, the key fact to remember here is that familial hypercholesterolemia results from defective LDL receptors, symbolized by our broken dock. So how does the lack of LDL receptor cause disease? Shift your gaze and look towards the coal-stained water at these floating life rings. If you remember our scene about apolipoproteins, you'll know that binding of lipoproteins to the LDL receptor is required for uptake and removal of cholesterols from the blood. Consequently, a defect in LDL receptor means that the body cannot remove LDL and the cholesterol it carries from the blood. Instead, both LDL and cholesterol build up inside the bloodstream. The many LDL life preservers freely floating inside the water should help you remember that LDL levels increase inside the blood, as they are no longer bound to our dock. The black coal in the water should help you remember that cholesterol levels also increase, which leads to the clinical complications of the disease. Now let's shift gears and focus on these complications. These will be represented by our old ape who has lost his usual spot on the dock. First, notice this clogged pipe in this ape's hand. This clogged pipe is a recurring symbol for atherosclerosis, as the scum inside should make you think of the buildup of plaque inside blood vessels. Familial hypercholesterolemia is characterized by premature atherosclerosis. Persistently elevated cholesterol levels accelerate plaque formation, leading to myocardial infarctions and strokes occurring in people as young as 30 years of age. Next, check out this oil stain on the back of this ape's calf. I guess this oil came out of the pipe. This oil splash is exactly what you think it is, a xanthoma, or deposit of lipids underneath the skin. The cholesterols not only deposit inside blood vessels, but also at the level of the skin. A classic location for these deposits is at the Achilles tendon, which is why we've drawn this oil splash behind this ape's calf. Lastly, check out this ape's glasses. See the milky white around the rims? We've drawn this here to help you remember the finding of corneal arcus, which describes a grayish-white ring visible in the periphery of the iris in patients with familial hypercholesterolemia. I like to also think of this as a deposit of cholesterols inside the eye. The constellation of these three findings, heart attacks or strokes in a young person, Achilles tendon xanthomas, and corneal arcus, is basically pathognomonic for familial hypercholesterolemia. Examiners love this because they can trick you into complacency with symptoms that appear purely cosmetic. Think about xanthomas and corneal arcus. They'll hide the family history by making the patient an orphan, but you need to be thinking about the big killers here. We're talking about coronary vascular disease and strokes. And that's it for familial hypercholesterolemia. Picture our broken dock to remember the defect in the LDL receptor, which in turn causes elevated LDL and cholesterol levels inside the blood. And don't forget our constellation of complications, and you'll be sure to recognize familial hypercholesterolemia on your exam. We'll see you next time.